My name is Dr. MarkAlain Dery. I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live here in New Orleans, Louisiana, and I serve as the co-chair for the ACOI Infectious Diseases Subspecialty Section. While this pandemic endures, together with the ACOI, hello ACOI, thank you for letting me do these videos. I'm going to continue to update you on COVID-19 news, but I'll be covering COVID less frequently during these videos, and going forward, we're going to intersperse other topics to keep you up to date on relevant issues of the day, especially as seen through the lens of osteopathic health, while also providing patient-centered care to our patients. Now, as providers, we have drastically seen how the realm of public health has influenced our personal and professional lives, whether we serve in academia, administration, research, in private practice, or even within the hospital setting. COVID has become synonymous with the term public health recently, and it has dominated our dialogue over the last year and a half, and rightly so. But we all know that there are other issues that deserve attention too. So together with the ACOI, we'll continue to share information on COVID-19 so that other public health concerns are noted as well. But I also want to remind you of an important upcoming event, and that is the 2021 ACOI Convention and Scientific Sessions. That's right, we are getting back together again. Give yourself a big hug, jump back and kiss yourself. October 27th through the 30th in Orlando. Registration and hotel reservations are being taken right now. And hurry. I hear that there are limited hotel rooms in the convention hotel, so sign up today. I want to see you there. I'll be there doing lectures. So, on to the stories. This month, we're going to be focusing on July being the Minority Mental Health Awareness Month, and we're going to talk about COVID-19 vaccine updates as well. What's all this talk about Novavax? I haven't heard anything, so let's talk about that. So, getting started, today we're going to talk about the BIPOC Mental Health Awareness Month, and in July, we're going to put our focus on Mental Health Awareness Month for BIPOC individuals. It was formerly called the Bebe Moore Campbell Minority Mental Health Awareness Month, and as we all know, regardless of the color of our skin, we all have a potential to suffer from mental health challenges. This guy did very openly during the pandemic. Anyway, BIPOC, by the way, replaced the word minority to refer to Black, Indigenous, and people of color. So, for communities of color, however, there's a greater struggle in terms of getting help for mental health issues. Typically, there is less access to care, cultural stigma, and unfortunately, there's lower quality care. And according to the U.S. Department of Health and Human Services, the Office of Minority Health, in 2019, suicide was the second leading cause of death for Black Americans ages 15 to 24. Now, I'm glad we're talking about this important awareness month since, as osteopathic healthcare providers guided by patient-centered medicine, we are compelled to provide support to anybody who needs mental health assistance, since we all know that physical health starts with good mental health. So, to shed light on this awareness and the origin of the Bebe Moore Campbell BIPOC Mental Health Awareness Month, let me give you a brief update on who Bebe Moore Campbell was. She was an author, she was a teacher, and she was a journalist. That's a great trio of things. That is the trifecta of awesomeness right there. She was also a mother. That's another great thing. Her daughter battled a mental health illness, and it was her struggles that motivated Bebe Moore Campbell to become a mental health advocate. She is known for creating safe space for Black people to talk about their mental health concerns, and her work has led the Congress to formally recognizing the Bebe Moore Campbell Minority the Bebe Moore Campbell National Minority Mental Health Awareness Month in 2008 to help bring awareness to the unique challenges that underrepresented groups face. Now, what has been discovered over the years is that not only are people of color limited in the access of effective mental health care, but there's also subject to discrimination. And the disadvantages that many BIPOC individuals face are not often seen by white individuals. We all know that everyday racism can create a cycle of microaggressions, which is a cause for anxiety, psychological distress, depression, and even suicidal thoughts in people of color. As providers, our job is to be sensitive to these conditions and not succumb to racial biases that create skepticism toward people of color in need of psychological care. Now, unfortunately, a common opinion that exists is that people of color are overly sensitive. No. In regard to racialized issues, and what happens is that individuals seeking support are often dismissed. Don't do that. Facing racial bias, which is whether it's in law enforcement or even in the physician's office, can be a toll as well, and it can lead to abuse or even reckless behavior. Now, there's been confusion when it comes to perceiving individuals rather than those who are in need of true mental health care. Other barriers to mental health care for people of color include fear of stigma within their own communities. A psychologist recently reported that many of her black clients avoid psychotherapy due to fear of judgment. And for many of us providers, this is about doing the right thing. And this is so important because this is why medical ethics are important. So deep listening and addressing complexity are part of what we do as osteopathic internists. Okay, now I want to provide a quick vaccine update. It's hard to believe that we're still in the pandemic. It's been a long time. And somehow we have more vaccine than we have people who want to take it. Go figure. Yet there's a new vaccine that's about to be available, and how does that factor in? This is the Novavax vaccine, which uses a more traditional vaccine technology and perhaps could help those who are hesitant to take the newer mRNA vaccines to actually take this new shot. Now, I spoke to Vice Magazine about what makes Novavax different from the Pfizer or Moderna vaccine. And as we've discussed here on this vlog, the mRNA vaccines give your body the instructions on what to do in case it detects the coronavirus spike protein, and those instructions help our immune system fight it. On the other hand, the Novavax is a subunit vaccine, and it is the same vaccine approach that we've taken since 1986 with hepatitis B, pertussis, and flu vaccines. Now, for people who shun the mRNA vaccines because they were developed too quickly, they may be more open to taking Novavax. Also, it has fewer immediate side effects, which has also scared people away from Pfizer and Moderna vaccines. Now, another big plus is that it does not need to be stored at the same freezing temperatures that the others do, so it actually makes global distribution actually much easier. And while the Johnson & Johnson was an alternative to the mRNA vaccine, the scare early on about blood clots turned away people from the vaccine. So there is hope that those individuals will now be more open to the Novavax vaccine. And more good news, it is effective. It is almost 96% effective in phase 1 trials, which is slightly more effective than both Pfizer and Moderna were in phase 3. Plus, it works against variants, including the Delta variant. But unfortunately, it will likely not be available until late September. While it may not make much of a dent here in the U.S., it may do so globally, and that could be the key to keeping more variants developing in unvaccinated populations around the world. So we're really looking out for Novavax. I think it's really going to be a very positive vaccine. And again, really getting it out to the rest of the world to be able to utilize it will be great, because as of right now, less than 1% of the individuals that live in resource poor or low income countries have been vaccinated. That's less than 1%. What does that mean? That means that those are the areas where variants are likely to emerge from. So in the future, stay on the lookout for these updates, and to read more from the sources used in this report, go to the acoi.org/COVID-19. Together with the ACOI, we will help you keep up with the latest information to help you respond to your patients to stay on top of the crisis. As always, I love getting your emails, so feel free to reach out to me directly at madery@mac.com. Please stay safe. We can do this together.